Hi, and welcome to Triad Seminars Online. This is the all-in-one day seminar, Clinical Evidence-Based Practice of Chiropractic Nutrition Part 1. This seminar is good for 6 hours of CE credit.
Welcome everybody to the nutrition section. It's a separate section. You will be getting your own approval number for these hours. It'll be on your certificate of completion of these hours. We'll have your approval number for this section. We're covering definitions, literature review, natural inflammatory reduction treatment options, including nutritional supplements and special dietary recommendations for an anti-inflammatory protocol. What is inflammation? Is when a wound swells up, turns red and hurts, may be a sign of inflammation. Inflammation is the body's immunity response to an irritant. This is by the Institute of Quality and Efficiency in Healthcare, 2015. Available at their PubMed Health page on October 12th, access to October 12th, 2016. Causes of inflammation: pathogen, germs, bacteria, viruses, external injuries, scrapes, foreign objects, chemicals or radiation. Any itis is an inflammatory condition in the body. Arthritis, inflammation of a joint. Bursitis, inflammation of a bursa. Body's response: it feels sick, exhausted, fever. The symptoms are a sign that the immune defense is very active and needs a lot of energy. Changes in blood, increased number of defense cells. Also, hormones are released in the tissues, narrowing the blood vessels, expand, allowing more blood to reach the injured tissue. Inflammation and autoimmune diseases. Inflammation is not always a helpful response. In certain diseases, the immune system fights against its own cells by mistake, causing a harmful inflammatory response, like rheumatoid arthritis, psoriasis, inflammation of the bowel, Crohn's disease, ulcerative colitis, fibromyalgia. The list goes on and on. So, it's an underlying, inflammation's an underlying root cause of every disease. It's the biggest problem in a chiropractic practice today. If patients take NSAIDs, non-steroidal anti-inflammatory drugs, like Advil, Tylenol, aspirin, they block pain signals and they damage your kidneys and they cause stomach problems. Okay? How many of you when you were growing up remember people on dialysis? Not many of them though, right? Only usually in the elderly, and only usually at a hospital to get their dialysis. Today, we have things called dialysis centers, like DaVita Dialysis Center, that's packed 24 hours a day, 7 days a week. Not with elderly patients. Packed with young people checking in at DaVita Dialysis Center around midnight, sleeping in a lounge chair or a bed now, there, and then waking up at 6 in the morning after their dialysis and going to work, being away from their families. Young people, 40s, 30s, unheard of. In a generation before this one, there was not one DaVita dialysis center. There was no dialysis centers anywhere in the United States. It's only done in a hospital in a rare. Today, everybody's kidneys stop functioning. The amount of NSAID usage is crazy. This is not candy. NSAIDs cause kidney damage. Proven fact in all the studies. So what are natural options for DCs? They would include turmeric, curcumin, black pepper, ginger, bromelain, saffron. I put C Organics Absolutely Pure supplements. Turmeric that's non-GMO in that supplement. Organic, gluten-free, and vegan. You have to take supplements today. At least supplements are a better option to medications. Whether they're over-the-counter medications or prescription, the first choice for a chiropractor would be food or dietary or supplements. Other options would be omega-3s, a huge increase in broccoli and cauliflower, or antioxidants or probiotics. Here's some references on inflammatory options.
During this section of the seminar, Dr. Simmert will be covering several research articles. You can follow along with the video, but once the video is over, we ask that you go back to your notes, look up the articles and read them. And if you have any questions, again, please email us at triadseminars@gmail.com, or you can call us at 949-707-5785. But again, it's your responsibility to go back and look at the notes in more depth, as this is part of your continuing education hours. Thanks so much, and we hope you enjoy the seminar.
Right now I want to talk about some current articles on turmeric. And there's a lot of articles, so I am not going to be going through the content of each one. I just want to let you know that I've added these to the turmeric section and research section. These are all current articles, 2019, November 1st. This article is entitled Curcumin Releasing Eggshell-Derived Carbonated Apatite Nanocarriers for Combined Anti-Cancer, Anti-Inflammatory, and Bone Regenerative Therapy. Once again, turmeric has been noted in the research to do three things. And those three things majorly are anti-inflammatory, exercise-induced muscle soreness, it reduces that, and muscle injury as well. And finally, anti-cancer properties in the medical research articles for turmeric. For hundreds, even thousands of years, they've been dealing with that. And the current medical research is loaded with those three categories. The next article I want to talk about is Curcumin, New Insights into an Ancient Ingredient Against Cancer. It's from April 12, 2019. It also talks about curcumin, which is turmeric, and how it applies there. So you guys can catch up on the most current research available. The next article is the impact on curcumin and its modified formulations on Alzheimer's disease. This is from the Journal of Cell Physiology from March 7th, 2019. And we know that Alzheimer's is a major problem, and curcumin is the main ingredient of turmeric, and it has been shown as a major antioxidant, anti-inflammatory, and has neurotropic activities. And that proposes a strong potential to prevent neurodegenerative diseases. So you can read that one. The next article is from Medicine Journal, 2019, April 3rd. It's called The Influence of Curcumin on the Downregulation of MYC, Insulin, and IGF-1 receptors, a possible mechanism underlying the anti-growth and anti-migration in chemo-resistant colorectal cancer cells. Excellent article on that. The next article is from the Journal of Ethnopharmacology, April 13th, 2019. Curcuma longa ameliorates asthma control in children and as adolescents. A randomized double-blind controlled trial. And the aim of this study was that to test the hypothesis that in children and adolescents with persistent asthma, the administration of powdered roots of Curcuma longa for 6 months, in addition to standard treatments compared to placebos, will result in a better disease control. And the results were very positive, and the conclusion stated that the powdered form or the powdered roots of Curcuma longa led to less frequent nighttime awakenings, less frequent use of short-acting androgenic agonists, and better disease control after 3 and 6 months when compared to a placebo. The next article I want to talk about is Curcumin exerts anti-inflammatory and vasoprotective effects through amelioration of NFAT-dependent endothelin-1 production in mice with acute Chagas cardiomyopathy. This article was from July 16, 2018. The background says the anti-inflammatory and cardioprotective properties of curcumin, a natural polyphenolic flavonoid isolated from the rhizomes of Curcuma longa, are increasingly considered to have beneficial effects on the progression of Chagas heart disease, caused by the protozoan parasite Trypanosoma cruzi. Conclusions in the article stated that oral treatment with curcumin dampens cardiovasculopathy in acute Chagas mice and regulated the release of ET1 from T. cruzi infected vascular endothelium. The next article I want to talk about is from June 19, 2018. It's the systemic administration of curcumin, the effect on anxiety-related behaviors in a rat model of post-traumatic stress disorder via activation of serotonergic systems. In this abstract, post-traumatic stress disorder, PTSD, is a trauma-induced psychiatric disease characterized by impaired hyperarousal, fear, extermination, depression, anxiety, and amnesic symptoms that may include the release of monoamines in the dread circuit. Curcumin, a major and polyphenolic component of Curcuma longa, reportedly possesses several pharmacological features, including anti-diabetic, anti-atherosclerotic, and anti-cancer, and anti-psychiatric actions. In the results suggested that curcumin has anti-anxiolytic-like effects on biochemical and behavioral symptoms associated with anxiety. Thus, curcumin may be a useful agent to alleviate or treat psychiatric disorders similar to those observed in patients with PTSD. In the publication called Physiotherapeutic Research 2018, June 19th, there's an article on curcumin in epilepsy disorders. In the abstract, curcumin, a principal curcuminoid present in turmeric, has an antioxidant, anti-inflammatory, and neuroprotective properties. Preclinical studies have indicated its beneficial effect for the treatment of epilepsy disorder. The molecule has an anti-seizure potential in preclinical studies. Curcumin also possesses an anti-epileptic activity as it reduces spontaneous recurrent seizures. The antioxidant and anti-inflammatory nature of curcumin might be responsible for its observed anti-seizure effects. In conclusion, curcumin might be beneficial in patients with epilepsy disorders of its but if its bioavailability issues are resolved. In the Journal of Medical Food in 2018, June 29th, there's an article on curcumin. It says, is curcumin a possibility to treat inflammatory bowel diseases? The inflammatory bowel diseases, IBDs, are mainly represented by Crohn's disease and ulcerative colitis that are characterized by chronic and relapsing inflammatory processes of the gastrointestinal system. Curcuma longa is a plant with several medicinal properties, including anti-inflammatory effects. As curcumin has remarkable anti-inflammatory actions, we consulted Medline, PubMed, PMC, and the literature search was performed with the following combinations of terms: inflammatory bowel diseases and curcumin, Crohn's disease and curcumin, ulcerative colitis and curcumin. Curcumin interacts with receptors, growth and transcription factors, cytokines, enzymes, and genes. These molecules are associated with inflammatory processes. These molecules are critical factors in the positive regulation of inflammatory cytokines in inflammatory diseases, suggesting that curcumin may be considered as a new therapeutic agent for patients with inflammatory bowel diseases. Curcumin is a natural anti-inflammatory agent that represents an attractive, safe, and inexpensive alternative for the treatment of IBD. Nevertheless, it's necessary to know the safe dose and consider the absorption rate. Another article from June 30th, 2018. The effect on prostatic specific antigen by a short-time treatment with a curcuma extract, a real-life experience and implications for prostate biopsy. In this study, PSA elevation is associated with prostate cancer, and it is used in screening programs for its diagnosis. It is one of the most common indications for referral to a urologist. There's no consensus about what to do in PSA elevation management. Antibiotics, nutraceuticals, or anti-inflammatories are commonly prescribed in daily practice. Our objective was to verify the effect on the PSA value of a short-term 30-day trial of curcuma extract. In the conclusion, the use of the curcuma extract for 30 days is able to lower the PSA value after the 30-day intake period. That's interesting. In the Journal of Food Drug Analysis from July 26, 2018, there's an article on synergistic effect of curcumin and its structural analog on anti-influenza virus infection. In the abstract, curcumin, a polyphenolic compound extract from spice and common food colorant turmeric, contains versatile bioactivities. Comparative analysis revealed that monoacetyl curcumin, MAC, effectively inhibited influenza virus to a similar extent as, if not superior to, curcumin. And more importantly, in the conclusion, curcumin in combination with MAC synergistically inhibited the influenza virus infection. In an article on July 3rd of 2018, it was entitled Anti-Aging Properties of Curcuma hyaenea, a scientific approach to its use in Javanese tradition. In this abstract, Timu Giring, the rhizome of Curcuma hyaenea, is native to tropical regions, especially in Indonesia. It is traditionally used as a skin care for cosmetic and body freshness. In Javanese and Balinese women, it has many other bioactivities such as antioxidant, anti-cancer, and anti-inflammatory. In the conclusions, the results show that curcumin hyaenea contains antioxidant compounds and has potent anti-aging activity, indicating that it can be used as an anti-aging drug candidate or as a phytocosmeceutical. In the Journal of Dietary Supplementation on July 18, 2018, there's an article called The Effect of Curcumin on Serum Copper and Zinc Ratio in Individuals with Metabolic Syndrome, a double-blind clinical trial. In this abstract, metabolic syndrome is a complex disorder with high socioeconomic costs and a high global prevalence. Curcumin is derived from turmeric and has antioxidant and anti-inflammatory properties. Curcumin may therefore have a potential role in the management of cardiovascular disease and risk. The aim of this study was to investigate the effects of curcumin on serum copper zinc ratio levels in patients with metabolic syndrome, a double-blind clinical trial in which 120 individuals with metabolic syndrome were randomly assigned. The next article is from Critical Review Food Science Nutrition 2019, February 11th. It's titled A Systemic Review on Black Pepper Piper nigrum from Folk Uses to Pharmaceutical Applications. You know, when I first started researching turmeric, a lot of chiropractors were telling me, are you putting black pepper in your formula? And when I started talking about doing a turmeric supplement, and I knew nothing about black pepper or piperine. And I started researching it, and it was starting to pop up in all the literature, and synergistically, a small amount of black pepper in combination with curcuma longa or turmeric is so much more effective than straight turmeric is. So I want to credit the chiropractors for leading me down that path. I probably would have found it anyway because it's loaded in the research, but thank you to the chiropractors that were up on this. And basically, black pepper is considered the king of all spices. It's a widely used spice. It adds flavor and enhances taste of the other ingredients, and it also has been explored as a biological properties, is bioactive phytocompound, and it synergistically works unbelievable when in combination with curcuma longa. So it should not only be regarded as the king of spices, but it's got to be considered because of its medicinal agents, compromising of bioactive compounds with potential nutraceutical and pharmaceutical applications. The main things I want to tell you about piperine is the same exact qualifications of curcuma longa. They're all my ingredients in that product are anti-inflammatory in the literature. They're for exercise-induced muscle soreness in the literature individually, and the anti-cancer properties or antioxidant properties as well. The next article is alkaloids from Piper nigrum synergistically enhanced the effect of paclitaxel against paclitaxel-resistant cervical cancer cells through the downregulation of MCI1. That's from the Journal of Agricultural Food Chemistry from May 8th of 2019. In the current study, 9 amide alkaloids, including 2 new dimeric amides and a new natural product, were identified from Piper nigrum, or black pepper. And this was the first time that this has revealed from plants that they possess a remarkable sensitization effect on cancer cells to paclitaxel. All right. In the publication Medical Chemistry 2018, there's an article on biology-oriented synthesis of piperine derivatives and their comparative analgesic and anti-inflammatory activities. In the abstract, the background serious side effects such as gastric, intestinal ulcers, bleeding, etc. are associated with most of the anti-inflammatory and analgesic drugs. So there is a need to search novel, potent, and safer anti-inflammatory and analgesic drugs. The results of this study talk about a number of derivatives that showed enhanced anti-inflammatory and analgesic activities as compared to piperine and standard drug diclofenac. Conclusion is the newly identified molecules may serve as a lead for future research and connection of potent and safer anti-inflammatory and analgesic drug candidates. In the publication Bioscience Report, May 31st, 2018, piperine functions as a tumor suppressor for human ovarian tumor growth. Piperine is a kind of natural alkaloid found in the fruit of black Piper nigrum and long Piper nigrum, has shown anti-tumor activities toward various cancer cell lines. In conclusion, these results provide the first evidence for the anti-cancer potential of piperine in ovarian cancer cells. In the publication European Journal of Pharmacology, July 19, 2018, there's an article on the evaluation of anti-nociceptive and anti-inflammatory activities of piperic acid. Piperine in the active compound of black pepper, Piper nigrum, from piperine was obtained the molecule of the piperic acid. The objective of this study was to evaluate the anti-nociceptive and anti-inflammatory of the compound. The anti-nociceptive effects of piperic acid were evaluated by abnormal writhing formalin, capsaicin, and tail flick tests, while the anti-inflammatory effects were evaluated by paw, oedema, and air pouch tests. The results presented suggests that the possible cholinergic action and vanilloid agonist of the piperric acid may be responsible by anti-nociceptive and anti-inflammatory effects. These effects are devoid of toxicity. This is a short article, one of the ingredients in turmeric from Animal Nutrition 2019, December 5th. It's on ginger extract enhances antioxidant ability and immunity of layers. This experiment was to investigate ginger extract on production performance, antioxidant ability, and immunity of laying hens. And in this study, it shows that ginger extract not only can improve the bird's antioxidant capacity, enhance immune function of the bird, but also has the potential of reducing the inflammatory response. Excellent article, once again, adding to the monster abundance of literature on turmeric. The next article is from Environmental Toxicology, May 1st of 2019. It is on the chemopreventive efficacy of zingerone in experimental colon carcinogenesis in Wistar rats. Wistar rats, by the way, are the primary source of medical research when it comes to different compounds tested. It's usually the preferred animal or rodent that they use in these studies. But in this, colorectal cancer is one of the most common cancers they talk about in the world, and this one they say that zingerone, and by the way, zingerone is ginger, if you haven't figured that out. So ginger or zingerone could be considered as good chemopreventive agent in experimental models of colon carcinogenesis. And they recommend further studies are required to study other pathways involved in colon carcinogenesis and their modulation by zingerone. So I want to do another disclaimer like I always do. These articles are, you got to take them for what they're worth. They're not promising a cure for anything. My products are not a cure for anything. They've not been tested by the FDA to be a cure for anything. But I put my formulas together based on research. And in the research, I take the most promising ingredients in the research and try to synergistically put them together in a supplement form just to help your body do what it's going to do. And so I'm not promising any results or cures or anything like that, but it's interesting to put these organic ingredients together and help your body fight whatever it's going to fight. And we could use all the help we can get in these times. The next article from Pain Medicine, April 15th, 2019, is the dietary ingredients as an alternative approach for mitigating chronic musculoskeletal pain, evidence-based recommendations for practice and research in the military, in the U.S. military, in the Special Operations Forces. And what they did was they took 76% of military service members and who use dietary supplements for various reasons, including pain and related outcomes. And the work evaluates current research on dietary ingredients for chronic musculoskeletal pain to inform decisions for practice and self-care for these special ops people. The conclusions showed that They have a lot of scientific research to establish definitive clinical practice guidelines, but the processes could be established to track the impact of these ingredients. Until now, or until then, when they wrote this article, providers have the evidence needed to make informed decisions about the safe use of these dietary foods or these dietary ingredients. And the future research can address existing gaps. So, the stuff that I put in my products are found in foods. They are foods. Turmeric is a root. You can get it at the grocery store. You could juice it. You could cook with it. It's used in many different cultures. The Indian culture, the Middle Eastern cultures cook most of their meals with curcumin or curry, and we put it in capsule form. Why? Because it makes a mess. It stains countertops. It's not easy to work with unless you're culturally used to it. Otherwise, you still need it in your body. I come from the Eastern European diet. We didn't cook with this in my family history, and so I'm not real comfortable or familiar cooking with it. However, I take it twice a day. So for me, it's an excellent source for me to get in my diet. I just take it in capsule form. This next section of articles are in the notes, and I'm not going to be going through them in their entirety, but I do want to just tell you the source, the year, the title of the article, and these are articles that you can additionally read to get more information. These are on some of the ingredients that are found in some of my products, but I wanted to show you the research is there if you do want to read the research behind it. I want to show you this is how we derive an ingredient in a supplement is because of the literature on that ingredient. So first one is on black ginger extract increases physical fitness, performance, and muscular endurance by improving inflammation and energy metabolism. This article was from May 24th of 2016, and that was that one. And the other one is on ginger alleviates hyperglycemia, induced oxidative stress. It reduces inflammation and apoptosis or cellular death, and protects rats against diabetic nephropathy. This is from Biomedical Pharmacology from 2018, June 29th. Another good article on ginger. Here's another article on ginger from the Medical Journal of the Islamic Republic of Iran, September 12th of 2015. In the article, it talks about the acute effects of ginger extract on biochemical and functional symptoms of delayed onset muscle soreness. This is an excellent article, and it talks about inflammation and pain induced by delayed onset muscle soreness as a result of eccentric exercise. And the conclusion shows that 2 grams of ginger per day may have an anti-inflammatory and an analgesic effect on delayed onset muscle soreness. So that's another ingredient found in my turmeric product. The next article was from Physiotherapy Research 2015, June 29th. It was the effects of pre-exercise ginger supplementation on muscle damage and delayed onset muscle soreness. Another great article on the same or similar topic. The next article I want to talk about is bromelain. And this is an article from January 18, 2019 on bromelain inhibits the ability of colorectal cancer cells to proliferate via the activation of ROS production and autophagy. So basically, advanced colorectal cancer survival rates are still low. Despite advances in cytotoxic and targeted therapies, the development of new, effective, or alternative therapies is therefore urgently needed. Now, bromelain is found in the core of pineapple, the core of the pineapple. That's the part of the pineapple that I usually throw away. And if you come from a Polynesian culture, Hawaii or the Polynesian cultures, they eat the cores every day. They don't throw them out. That's the primary part that they eat. It's not the sweet part and it's not the easy part to eat. But those cultures cook with that. They eat it. They eat it after practice for sports. And it's an extract. We use it in a form of an extract in our supplement. And it's shown to have anti-cancer effects in the literature. And it also shows the roles of bromelain they tested it in mice. And the anti-cancer mechanisms were explored by assessing the role of bromelain in inducing reactive oxygen species, which is ROS. And it's superoxide. And it also has autophagosomes and lysosomes. And the role in the induction, bromelain's role in the induction of apoptosis was also assessed, which is cellular death. And the study explored the role, and while giving insights into its mechanisms of action, this compound can offer a very cheap alternative to current therapies or add it in addition to current cancer treatments and therapies. Once again, I'm not claiming that bromelain cures cancer. It's just something that has shown in the scientific research to have a positive effects. It's something that should be at least looked at. In the publication dated April 2nd, 2018, there's an article on bromelain-loaded nanoparticles, a comprehensive review, state-of-the-art. Abstract. Stem bromelain is a common available cysteine protease derived from pineapple, usually the core. Bromelain finds widespread applications in several areas such as medicine, health, food, and cosmetics. Bromelain has played different roles, and thus this paper aims to review the available literature for the use of nanoparticles and bromelain. Bromelain has been a treatment in Polynesian cultures for anti-inflammatory for many years, and here we are in 2018 studying the widespread effects of it. In the European Journal of Obstetric Gynecology Reproductive Biology, if that's not a mouthful, July 6th of 2018, the effectiveness of an antioxidant preparation with N-acetylcysteine, alpha-lipoic acid, and bromelain in the treatment of endometriosis-associated pelvic pain. The objective of the study was to assess the impact of an antioxidant preparation with N-acetylcysteine, alpha-lipoic acid, and bromelain on endometriosis-associated pelvic pain. The conclusion showed that women with endometriosis who wish to become pregnant and are treated with preparations containing N-acetylcysteine, alpha-lipoic acid, and bromelain experienced a significant improvement in endometriosis-associated pelvic pain and required lower intake of rescue analgesics. In the publication Biomedical Pharmacological Therapy from June 29, 2018, there's an article on ginger alleviating hyperglycemia-induced oxidative stress, inflammation and apoptosis, and protects rats against diabetic nephropathy. Oxidative stress plays a major role in the development and progression of diabetic nephropathy. In this study, the potential protective effect of zingiber rhizome extract on hyperglycemia-induced oxidative stress, inflammation, was investigated. In the conclusion, this study strongly suggests that zingiber or ginger rhizomes extract exert a protective role against diabetes-induced renal injury by ameliorating oxidative stress, inflammation, and apoptosis. In the publication Archaeological Physiological Biochemistry from March 14, 2018, this article talks about zingerone ameliorates renal function via controlling oxidative burst and inflammation in experimental diabetic nephropathy. In the abstract, development of diabetic nephropathy is directly linked to oxidative stress and inflammation. In this context, inflammatory and oxidative markers have gained much attention as targets for therapeutic intervention. We studied the effect of zingerone. Zingerone, also known as vinyl, I can't even pronounce that word, sorry. Acetone is a pharmacologically active compound present usually in dry ginger. In the treatment with zingerone reduced the levels of other downstream inflammatory molecules. Furthermore, zingerone treatment improved renal function by significantly decreasing the levels of kidney toxicity markers. These findings indicate that zingerone treatment improved renal function by anti-hyperglycemic, antioxidant, and anti-inflammatory effects, suggesting the efficacy of zingerone in the treatment of diabetic nephropathy. In the publication Biomedical Pharmatherapeutics from September 10, 2018, therapeutic efficacy of zingerone against vancomycin-induced oxidative stress, inflammation, apoptosis, and permeability in the rat kidney. Abstract. Vancomycin is a glycopeptidic broad-spectrum antibiotic. It's supposed to be resistant against Staph aureus, though it has some adverse effects of its own that limit its usefulness. Zingerone is a component of dry ginger root, has several pharmacological activities due to its antioxidant, anti-inflammatory, and anti-apoptic properties. The aim of this study was to determine the therapeutic efficacy of zingerone against vancomycin-induced oxidative stress, inflammation, apoptosis, and kidney aquaporin. In the treatment with zingerone, ginger, at both doses prevented nephrotoxicity by ameliorating the histopathological alterations, oxidative stress, inflammation, apoptosis, oxidative DNA damage, and renal levels. The findings of the present study suggest that zingerone attenuates the vancomycin-induced nephrotoxicity. And there's the references. Lots of references, folks. There's the turmeric. You take 3 of these. You can take them anytime, day or night, with or without food. If you have a sensitive stomach, always take a little bit of food with your supplements if you have a real sensitive stomach. If you don't have to. I take my turmeric at night just because you're more inflamed at night, usually, than you are in the day. So that's what we do. However, you don't need to. Okay? And it's got EDTA in there, vegetable cellulose capsule, made with organic ingredients, the whole thing. Very cool supplement. Been my most popular supplement sales-wise to date. It's a perfect product for a chiropractic practice. Dietary recommendations now. You asked me, what are more things? Okay, so we got a good supplement. Now what else? How about diet? Dietary changes. How about adhering to an anti-inflammatory diet? You know, you got patients, they're totally inflamed. But what are they eating? Junk. They got to change their diet. Diet's one of the biggest things they can do. They got to be strict though. If they really want to get better, they're going to have to be strict. Eliminate your triggers like your dairy, your gluten, etc. That's an anti-inflammatory start. How many people eat dairy? You know what it's like eating dairy today? Do you remember what an auger dish is in chiropractic school? What's an auger dish? Petri dish, but what was it made with? Auger. What is the auger? It's a medium that bacteria just can grow on. So we use auger in the Petri dish. And anytime viruses or bacteria land on the auger dish or the Petri dish, it just grows. Like in chiropractic school, we did an experiment where we set up auger dishes every 5 feet from the person in the front of the room, all the way to the back of the gymnasium. Auger dishes. They were all open. Took the lid off. The person in the front of the room had a bad cold. They sneezed. We waited till them to sneeze. As soon as they sneezed, we lifted off the lid of the auger dish and we waited for a minute. And then everybody closed their lid. Then we collected the auger dishes and we wrote down on them how many feet they were from the person who sneezed. And then we started monitoring the growth of bacteria that was growing on the auger dish. So the auger dishes in the closest to the sneeze were filled with growth and bacteria. But guess what? The auger dishes in the back of the room, in the gymnasium, still had the same exact bacteria on it from the sneeze, but in a smaller quantity. So if somebody sneezes in this room today, we all breathe it. Every single one of us. They can't sneeze into their sleeve and do the trick. It doesn't work that way. Oh, like the germs are going to stay on the sleeve. They love sleeves, by the way. Germs love sleeves. Make sure you sneeze into your sleeve. Brilliant Department of Health recommendation by the state of California. Sneeze into your sleeves. It is. I'm not making it up. I can't make it up. You guys have something called Google. Pretty much everything I say today, you're Google. I see you guys. I don't know if that's right. No. Simmering BSing again. I used to be able to BS. Now with Google, I can't say anything. You guys are keeping me honest. That's why I have research. I don't make anything up. All right? You guys will call me on it if I do, believe me. Which is good for all of us, really. I don't care. Google me. Google things I'm saying. That's fine. Stimulate your brain. Do something. You get all this energy from the aminos, right? How many of you feel a little more energy right now? Anybody? Good. It's amazing, isn't it? You were snoozing out earlier. Now everybody's a little bit more alert sitting there. I don't see the head bobbing anymore. All right. Avoid nightshade vegetables such as eggplant, peppers, tomatoes. Now, are they bad vegetables? No, but if you're full of inflammation, they're not great for you. As far as the anti-inflammatory diet goes. Increase your omega-3s. Limit your red meat intake. If you're inflamed, limit it completely. Increase lean meat if you're not that badly inflamed. Minimize foods that contain corn oils, safflower oil, sunflower oil, soybean oil, and cottonseed oil. These are all pro-inflammatory. Eat smaller, more frequent meals throughout the day. Question?
I was told that mixing turmeric and black pepper and an oil combination, coconut oil, is even more effective.
Yeah, the question is, what if you mix turmeric, black pepper, and coconut oil? I don't know exactly that study or article. However, doesn't sound like it's that far off. So, people tweak things differently. So yeah, I'm not anti-coconut oil. People are big fans of that today. It's better than these other oils. Foods may be considered alkaline or acidic outside of the body. However, we are interested on how the food will react to when it's inside of the body. Example, lemon is acidic in nature, but has alkaline effect on the body when digested. So we can't just go off of what the food is on a tree. It's how does it work synergistically with our body. Let's start with acidification of the body. Most foods in the standard American diet are acid forming. Acid interferes with digestion, food stagnates and rots, lowering the pH of the human body. A 16-ounce bottle of soda has a pH of number 2. It's very acidic. To bring the pH back up to a normal, neutral 7.3, we would have to dilute the soda with about 10 gallons of water. So if you drink soda, there is no hope for you. You couldn't drink enough water to neutralize that soda if you tried. There is no hope. It is one of the worst things you can put into your body. So don't try to defend it just because your taste buds like it. Stop eating for your taste buds. Start eating for your health. I know that's a little boring. I know a lot of people that eat for their taste buds. I went to Europe and I had a piece of cheesecake you could die for. They're still talking about the piece. I go, how was your trip to Europe? All they do is tell me about all the cheesecake they ate. What type of cheesecake? Which restaurant? Who cares? I want to hear about Europe. But these people have a disorder. They're eating for their taste buds. They're living for their taste buds. I go, don't eat that, French fry. Oh, but I love fries. I love them. Well, you don't love life, do you? I love ice cream, Doc. I gotta have my Haagen-Dazs every night. Love it. Oh, you love GMO ice cream, dairy, and sugar. Can I think of one ingredient that's even positive in that item for your health? You're eating for your taste bud. You're not eating the Haagen-Dazs for your health. I'm guilty. I was guilty of that. I used to eat a pint or a quart of Haagen-Dazs every night during chiropractic college. I did. Didn't gain a pound. I'd just go and buy strawberry Haagen-Dazs, load in my freezer with it, and every night have a pint of it. I had no limit. Never gained a single pound from it. But it wasn't very healthy for me. My classmates were looking at me like, oh shoot, he's going to die by the time he's 30. I don't do that today. I would love to do that today if I was eating for my taste buds. Because I love the taste of strawberry Haagen-Dazs. I mean, to me, that's one of the best tastes in life. As a matter of fact, right before I die, I would like that on my palate as one of the last things that's on my palate before I die. I'm putting that in my, my living trust. When I'm on hospice, I want Haagen-Dazs every night and every day. But until then, I'm eating for my health. The blood must maintain a pH of 7.3 to 7.45 according to Guyton's physiology. The body begins to sweep extra acids into the tissue if it's too acidic. To try to maintain that pH, the body's sweeping the extra acid into the tissues, into the muscles, into the joints. It's called lactic acid. Those of you who work out know what lactic acid is. You go to the gym or you do a heavy workout and you have muscle soreness. And that's a buildup of extra lactic acid in your body. And it's sore, it makes you sore. But if you have too much of that acid, the body, as a final effort to keep from acidifying, the body will actually precipitate the acids out of solution and put it in the form of a crystal, salt, or stone, like a kidney or gallstone, or a uric acid crystal. And this is the sign that the body systems are functioning as they should. Otherwise, we'd be dead of something called acidosis. You ever heard of ketoacidosis? You know, we don't want acidosis. And we don't want uric acid crystals lodging in our big toe, do we? How many of you have ever had gout? Anyone in the room? Anyone know anybody that's had gout? What's gout described as?
Painful.
Painful. I remember my dad had it. And my dad said to me, don't put any sheets over my feet when I sleep. I can't. The weight of the sheet is excruciating. Not a blanket. He was talking about the cover sheet, right? He didn't sleep with anything when he had gout attack. Like naked as a jaybird. He just do not cover his feet. That hurt. For men, gout is compared to childbirth for a female. Now, I don't know how you can compare anything to anything, but that's what they claim. It's a painful thing. You got a uric acid crystal lodged in the joint of the big toe. Now, I had a lady patient, 80, she turned 80, and she came in right on her 80th birthday with a walker all of a sudden. Walker, slowly limping. I go, Barbara, what happened to you? She said, diabetic neuropathy. Now, I've been treating this patient for 25 years, since she was 55 years old. She's 80 now. And I'm like, I'm not diabetic neuropathy. What do you, no way. I go, take off your shoe and sock. I want to see your foot. She takes off her shoe and sock. I took one look at her toe. I said, sorry to inform you, Barbara, but you got gout. She goes, I knew you were going to say that. I go, what do you mean you knew I was going to say that? Because I went to my RD yesterday, my real doctor. You've just been the chiropractor for 25 years, but I went to my RD. And he said it wasn't gout. Diabetic neuropathy. I said, Barbara, let me ask you a couple questions. Do you eat red meat? She goes, I knew you were going to ask me that question. And the answer is no. I don't eat red meat. And I told that to my RD. I go, oh, so you don't eat red meat? Nope. What about soda? Sodas, highly acidic sodas. She goes, don't mess with my Diet Pepsi, Dr. Simmerin. Don't even go there. I go, how much do you drink? Don't mess with my Diet Pepsi. I'm not giving it up. I go, how many do you drink a day? She goes, well, I buy it by the case at Costco, and I drink 2 to 4 a day. Okay, you don't need to eat red meat when you're drinking 2 or 4 Diet Pepsis a day. You have plenty of acid to go around. I said, come into my office. She came to my office. I went on my computer. I Googled images of gout, gouty arthritis. I said, do these look like your big toe? She goes, I know it looks like it, but my RD said it was diabetic neuropathy, and that's it. I said, well, I disagree with that diagnosis. She comes back 2 days later. She's still limping. She goes, Dr. Simmerin, you were right. I go, what do you mean? She goes, I went to a different doctor. I took my shoe off and sock off, and the first thing he said to me is, that's gout. Just like you did. I go, oh, great. So now you believe me. Now you're going to finally change your diet. She goes, no, no, no. He told me I didn't need to change my diet. I could stay on my Diet Pepsis. All I had to do is take this pill for the acid. He didn't want me to change my diet. He said diet has nothing to do with gout.
Really?
Just take the pill. See? Much easier to take a pill than to make a dietary change. Still didn't listen to me. 25 years. She had to get it from a different RD. And his recommendation for treatment's way different than mine. Mine was no treatment. Just eliminate what your taste bud is craving, and you'll be fine. What a concept. Health in America. You know how you can be healthy? Eliminate. That's how you're healthy. Without drugs, without surgery. Just stop doing what you are doing. Remember Seinfeld had an episode called The Show of Opposites. It's when George Costanza, his life was going, his best friend, Jerry Seinfeld's best friend on the show, his life was going so bad. They were sitting in the coffee shop, and George goes, "I just don't get it, Jerry. I'm 40 years old. I live at home with my parents. I have no job. I have no girlfriend. Everything I say to people is always the wrong thing." So Jerry's sitting there, he's going, well, wait a minute. If everything you say is always the wrong thing, then stop yourself, don't say what you're thinking, and say the opposite of what you were gonna say. And see what happens. Maybe your life will change. It's yin and yang. So George goes, "No, it's not gonna work." He goes, "Go try it. There's a beautiful girl. Go tell her the opposite of what you're thinking." He goes, "Okay." He goes up to her and he goes, "Hi, nice to meet you. My name's George. I'm 40, fat, bald. I live at home with my parents, and I have no job." She goes, "Oh, nice to meet you." It worked. Saying the opposite. So let me just relate that back to your health. Let's say your health sucks. Let's just say your health is not going the way you want it to go. Why don't you try doing the opposite of what you are currently doing? If you don't eat right, start eating right. If you don't take supplements, start taking them. If you don't exercise, start exercising. If you can't sleep, try meditating before you go to bed. Try taking calming teas. Whatever. Do something. Put your body in motion. The opposite way of what you were doing. Just see what happens. Try the George Costanza approach to healthcare. Because that's where healthcare begins for sick people. Just stopping what they're doing. Forget any doctor, any supplements, or anything. Just stop doing what you are doing. Stop the strawberry Haagen-Dazs every night. Just try that. See what happens. A new article supporting the Greens as well, and that is some more articles on that would be a randomized clinical trial from the American Journal of Clinical Nutrition, February 24th, 2020. It says a randomized clinical trial of the effects of leafy green vegetables and inorganic nitrate on blood pressure. A diet rich in fruits and vegetables is associated with lowering of blood pressure, and inorganic nitrate present in leafy green vegetables is converted into nitric oxide in vivo to improve cardiovascular function. Another article on green leafy vegetables comes from the Journal of Pharmacological Analysis in December of 2017, and it talks about the analysis of phenolic
acids and flavonoids from green leafy vegetables. And diets containing high proportions of fruits and vegetables can reduce the risk of onset of chronic diseases. In the research, the green leafy vegetables are the richest source of phenolic compounds with excellent antioxidant properties. They may give positive and better results to human health and significantly improve the immune system. So the greens are a major immune system booster. Here's another article on immune health from Nutritional Revelations of 2019, May 30th. It's called The Effects of Dietary Nitrate on Inflammation and Immune Function and Implications for Cardiovascular Health. Inorganic dietary nitrate found abundantly in green leafy and some root vegetables elicits many beneficial physiological effects, including a reduction in blood pressure and improvements in blood flow through nitrate, nitrite, nitric oxide signaling. Recent animal and human studies have shown that dietary nitrate and nitrite also modulate inflammatory processes and immune cell function and phenotypes. Another supportive research on immune function and green leafy vegetables. Here's another one from 2020, February 28th this year, on the bioactivity evaluations of leaf extract fractions from young barley grass and correlation with their phytochemical profiles. So they pressed juice of barley grass, and they've assumed the benefits and testimonies for many years from various ailments. People have recorded benefits from this as from conditions like anemia, cancer, GI problems by consuming barley grass. It has been known to be a chemoprotective action, high antioxidants, and RBC membrane stabilization, activity and toxicity stabilization as well. The next article is going to be from Maca. So it's from the International Journal of Biology and Macromorphology from March 13th, 2020. And this article talks about the extraction of polysaccharides from maca and the characterization of immunoregulatory effects of CD4 T cells. This would be found in our immune formula, our new immune formula, as well as our greens formula. And the immunomodulatory effects of maca polysaccharides on macrophages have been demonstrated in many studies. And what they found is that the maca polysaccharides isolated in our study have immune potentiation effects on the development of T cells of the immune system response. This is an article on another ingredient called nopal, found in our green supplement. This and its effects on metabolic syndrome, new insights for the use of a millenary plant. This article is from Current Pharmaceutical from 2019. So nopal is, by excellence, the most utilized cactus in human and animal nutrition. So that's what it is when you hear nopal, what it is, a cactus. And the treatment, it is a major treatment of metabolic syndrome, which is predominantly related to diabetes mellitus. So The conclusion of this study shows that nopal constitutes one of the most studied members of the cacti family. Its potential effects on human health have been described since ancient times. And it is an amazing treatment of metabolic syndrome. The next article is on spirulina. It's also in our greens product. It's from Oxidation Medical Cell Longevity from 2017. And the title is Antioxidant, Immunomodulating, and Microbial Modulating Activities of the Sustainable and Eco-Friendly Spirulina. The highly nutritional, eco-friendly spirulina has a hypolipidemic and a hypoglycemic and an antihypertensive properties. Spirulina contains many functional compounds with antioxidant and anti-inflammatory and immunomodulating effects. Spirulina suggests that it is safe and healthy in all subjects, and it has been a very functional food with a potential beneficial effect on human health. The human interventions used only by supplements. Therefore, the effect of foods containing spirulina should be evaluated in the future. The next article on green leafy vegetables and the greens product would be spinach. It's from Food Functionalization of 2016. It is an article called Functional Properties of Spinach, the Phytochemicals and Bioactives. Overwhelming evidence shows that diets rich in fruits and vegetables are protective against common chronic disease patterns such as cancer, obesity, and cardiovascular disease. Leafy green vegetables in particular are recognized as having substantial health-promoting activities that are attributed to the functional properties of their nutrients. Spinach is derived from phytochemicals and bioactives and is involved in metabolism, proliferation, inflammation reduction, and antioxidant defense. That's why Popeye used to eat spinach back in the day. In Green Superfood Research 2018, we see the Journal of Nutrition on May 14th, 2017, talks about cruciferous vegetable intake is inversely associated with lung cancer risk among current non-smoking men in the Japan Public Health Center study. In the background, cruciferous vegetables is a rich source of isothiocyanates have been reported to lower the risk of several types of cancer, including lung cancer. In the conclusion, the study suggests that cruciferous vegetable intake may be associated with a reduction in lung cancer risk among men who are currently non-smokers. You can read this article in its entirety. In the publication Lipids, Health, Disease, June 15th, 2018, green leafy vegetables and diets with a 25-to-1 omega-6, omega-3 fatty acid ratio modify the erythrocyte fatty acid profile of spontaneously hypertensive rats. In the background, in addition to the actual composition of the diet, which is nutrient composition, food groups, the omega-6, omega-3 fatty acid ratio has been demonstrated to influence the tissue fatty acid profile and subsequently the risk for cardiovascular and other diseases. Likewise, the consumption of green leafy vegetables may favorably reduce the risks associated with those diseases. In the conclusion, the present study demonstrates the ability of green leafy vegetables to mitigate the potential effects of an of an elevated W6W3 FAR, which may contribute to an atherogenic fatty acid profile, inflammation, and disease pathogenesis. Dietary recommendations for disease prevention should consider now the inclusion of these green leafy vegetables. In the publication Food Science Nutrition from March 15th, 2018, green leafy vegetables from 2 Solanum species ameliorate scopolamine-induced cognitive and neurochemical impairments in rats. The study examined the modulatory effect of black nightshade and African eggplant leaves on cognitive function, antioxidant status, and activities, critical enzymes of aminergic and cholinergic systems of neurotransmission. This study has shown that dietary inclusions of African eggplant and black nightshade could protect against cognitive and neurochemical impairments induced by scopolamine, and hence these vegetables could be used as a source of functional foods and nutraceuticals for the prevention and management of cognitive impairments associated with diseases such as Alzheimer's disease.
How many of you have ever drinking those green superfood drinks, powders? What do they taste like? They don't taste very good. And the good ones have sugars and sweeteners to get them sweet enough to get them down. And if they don't have sugars and sweeteners, then you end up mixing it into a juice, which is all sugar. It defeats the whole purpose of taking a green powdered superfood. So we decided to be one of the only companies ever to put it in a capsule. Piece of cake now. If you want green, organic greens every day, no matter how busy you are, no matter how many things you got going in your life, and you don't have time to eat your greens, here is your supplement. You will never go a day without a concentrated form of organic greens in your diet now. Here's the ingredient list. First of all, it's 100% organic ingredients, except for the capsule, which I gotta figure out if I'm allowed to say that, since the capsule is not. Because you have wheat, organic wheatgrass, organic barley grass, organic alfalfa, organic spirulina, organic chlorella, organic nopal, organic spinach, organic maca, organic rose hips, organic chia, organic fenugreek. How do you pronounce that? Fenugreek. Greek. Fenugreek. Organic gata cola. Organic hemp. Organic mesquite powder. Organic sacha inchi seed powder, which are omega-3s. Organic flaxseed, omega-3s. Organic oatgrass, organic kale, organic green tea matcha, organic milk thistle, organic euthero root, organic rhodiola, organic reishi, organic holy basil, ashwagandha organic, astragalus organic, schizandra organic, organic licorice, and organic ginger. This is a killer product. It's not even out, and I'm super happy with it. Everyone who's beta tested it has been telling me how much they love it. No side effects. Huh?
It's food.
It's food, it's organic, it's gluten-free, it's vegan, it's non-GMO. That's what I want to put into my body. Minerals and collagen. Functions of minerals: structural, bones, teeth, ligaments, solutes and electrolytes in the blood, enzyme actions, cofactors that create enzyme reaction, transmission, and muscle action. Best type of mineral supplements: chelated minerals are bound to stuck to a certain carrier molecule. Chelation can include minerals, vitamins, or enzymes. Minerals in food may be bound with organic molecules already in a chelated state. Many molecules in the body are chelated in normal metabolic processes. Chelation therapy is the treatment for removing heavy metals from the blood. Toxic metals are bound to a therapeutic amino acid ligand called EDTA.
The next article is from the Journal of Dairy Sciences, April 1st, 2018. And it's entitled Invited Review: Mineral Absorption Mechanisms, Mineral Interactions That Affect Acid, Base, and Antioxidant Status, and Diet Considerations to Improve Mineral Status. So, several minerals in this study are required for life to exist in a human being. In humans, there are 7 elements: calcium, potassium, magnesium, phosphorus, chloride, and selenium, and sodium. They're all required to be present in the diet in fairly large amounts. It's actually tens of grams each day for human consumption, and they're termed macro minerals. That's what they call those. And basically, those minerals, when consumed in excess, can become pro-oxidants in the body and generating destructive free radicals if you take too many. That's why it's very important when you take minerals that you don't take more than it's recommended on the bottle. More is not better with minerals. So you could get complex interactions between minerals can compromise the effectiveness of a diet in promoting health and productivity. So you need to realize that some supplements will not hurt you to take more, but others will cancel each other out. It's very important that you only take the recommended amount of minerals that are on the bottle. Don't take more. It's not going to be better for you. Like, for example, vitamin C. Jack LaLanne used to take 25,000 IUs of vitamin C per day. And we all know how many Guinness Book of World Records that guy has set due to the fact that he was in such great athletic shape. Even in his mid-90s, he was in good athletic shape. So it didn't seem to hurt him taking that many. Now, that would be a lot for me and you. I take 1,000 IUs a day, or sometimes up, if I want to boost my immune system, I'll take up to 3,000 in a day. But I'm certainly nowhere near the Jack LaLanne level of 25,000. So I'm just saying it didn't hurt him, and it's not toxic if you took too much vitamin C. However, with minerals, the opposite. You don't want to OD on minerals. You're not going to get sick or OD, but it won't work. It'll cancel each other out. Next article is on magnesium and malic acid supplement for fibromyalgia. In this study, fibromyalgia is an autoimmune disease, is characterized by myalgia, which is muscle pain, and a combination of different symptoms including pain, fatigue, insomnia, morning rigidity, depression, and a reduction in everyday functioning. People with the etiology of fibromyalgia is not really clear, but it's been suggested that deficiency in certain minerals, such as magnesium, may play a role in the physiopathology and contributing to the symptoms of fibromyalgia. In the conclusion of the article, we identified 7 systematic reviews, which included 11 primary studies, of which one was a randomized trial. Our conclusion in the study was that the use of magnesium and malic acid in patients with fibromyalgia makes little or no difference on pain, but has a positive result on reducing other symptoms. So that's that. The next articles I want to go over is on certain minerals found in our mineral supplement. This one's from Trials publication 2019, May 28th. It's the effect of magnesium citrate, magnesium oxide, and magnesium sulfate supplementation on arterial stiffness in healthy overweight individuals, a study protocol for a randomized controlled trial. In this article, we like to study the arterial stiffness is closely related to the process of atherosclerosis, an independent cardiovascular risk factor, and predictive of future cardiovascular events and mortality. Recently, we showed that magnesium citrate supplementation results in a clinically relevant improvement of arterial stiffness. Next article is from Current Rheumatology 2019. It's on selenium and autoimmune diseases. Selenium is an essential trace element with fundamental effects on human biology. Trace element deficiency is not uncommon finding in autoimmune diseases. It shows evidence showing the association between selenium deficiency and generation of reactive oxygen species and subsequent inflammation of the body. Reviewing the role of selenium in collagen vascular diseases could help researchers to devise strategies for managing these type of autoimmune diseases. Next article is from Biological Trace Element Research from April 19th, 2020. This article is on selenomethione. I can't even pronounce this. Selenomethione. Okay, I got it. 3 times the charm. That is able to relieve the effects of inflammation in various tissues and organs. There is a few studies about the influences of organic selenium resisting inflammation. Organic selenium can raise immune function, and they can conclude from this article that organic selenium increases the function of immunity and the immune system and the expression of selenoproteins and mitigates the inflammation induced by autoimmune diseases. The last article on selenium, selenium is from Redox Biology 2020, January 29th. Same word, selenomethionine or methionine. Supplementation reduces lesion burdens, improves vessel function, and modulates the inflammatory response within the setting of atherosclerosis. Atherosclerosis is a chronic inflammatory disease of the vasculature characterized by the infiltration of activated neutrophils and macrophages at sites of damage within the vessel wall, which contributes to lesion formation and plaque progression. Selenomethionine is an organic form of selenium. It's an essential trace element that functions in the regulation of the immune response by both bolstering the endogenous thyrodoxin and glutathione antioxidant defense systems within the body. It's got potential beneficial effects. That's why we want to get organic forms of selenium into our diet. In Chelated Mineral Research of 2018, in the publication Biology Trace Elements Research from May 18th of 2018, we see an article on growth performance, mineral digestibility, and blood characteristics of ostriches receiving drinking water supplemented with varying levels of chelated trace mineral complex. The effects of water supplementation on chelated trace minerals designed with chelate compounds technology. On growth performance, apparently total tract digestibility of minerals and some blood metabolites, chelated trace minerals, and antioxidant enzyme values in African ostriches were investigated. In conclusion, supplementation of chelated trace minerals to the drinking water can be recommended for improving growth performance, mineral absorption, and antioxidant status of ostriches fed diets containing the recommended levels of inorganic chelated trace minerals. In the Journal of Dairy Science, April 10th, 2018, invited review, mineral absorption mechanisms, mineral interactions that affect acid-base and antioxidant status and diet considerations to improve mineral status. Several minerals are required for life to exist. In animals, there are 7 elements: calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur are required to be present in the diet in fairly large amounts and are termed macro minerals. Several other elements are termed micro minerals or trace minerals because they are required in much smaller amounts. In most cases, the minerals in the diet must be absorbed across the gastrointestinal mucosa and enter the blood as if it is to be of value to the animal. The bulk of this review is to discuss paracellular and transcellular mechanisms used by the gastrointestinal tract to absorb each of the various minerals needed. Unfortunately, interactions between minerals and other substances within the diet can occur within the digestive tract that impair mineral absorption. The attributes of organic or chelated minerals that might permit diet minerals to circumvent these factors that inhibit absorption of more traditional or inorganic forms of these minerals are discussed.
Once absorbed, minerals are now used in many ways. One focus of this review is the effect of macrominerals have on the acid-base status of the animal. Many microminerals play a role in the body as cofactors of enzymes or triggers involved in controlling free radicals within the body and are vital to antioxidant capabilities. Those same minerals, when consumed in excess, can be too much and become pro-oxidants in the body, generating destructive free radicals. So more minerals are not better. Complex interactions between minerals can compromise the effectiveness of a diet in promoting health and productivity of the cow. You just want the right amount. Minerals are not something you want to take too many of. In this article dated June 17, 2018, from a publication called Fish Physiology Biochemistry, where they were looking at the nano-delivery of trace minerals for marine fish larvae, the influence on skeletal ossification, and the expression of genes involved in intestinal transport of minerals, osteoblast differentiation, and oxidative stress response. During the last few decades, the research community has made great efforts to develop artificial diets which can completely substitute live prey. However, studies aimed determining optimal levels of minerals in marine larvae compound feeds and the potential of novel delivery vectors for mineral acquisition has only very recently begun. Recently, the agro-food industry has developed several nano-delivery systems which could be used for animal feed too. Delivery through nano-encapsulation of minerals and feed additives would protect the bioactive molecules during feed manufacturing and fish feeding and allow the efficient acquisition of active substances into biological system. The idea is that dietary minerals in the form of nanoparticles may enter cells more easily than their larger counterparts enter and thus speed up their assimilation in fish. Accordingly, we evaluated the efficacy of early weaning diets fortified with organic or inorganic or nanoparticle forms of trace minerals. Our data demonstrated that weaning diets supplemented in amino acid chelated organic or nanoparticle forms were more effective than diets supplemented with inorganic forms of minerals to promote bone mineralization and prevent skeletal anomalies in sea bream larvae. So even though this is out of the human spectrum, it does talk about the type of minerals that work on a system versus the type that don't. And chelated is definitely a workable form from all studies. We'll go to collagen protein. Collagen protein. Largest protein in our body. 65% of the total body protein is made from collagen. Collagen protein makes up heart, lungs, blood vessels, discs, muscle, bone, and internal organs. Ptosis. You guys know what ptosis is? What's ptosis? Drooping. He said eyelid. Anything that droops is ptosis, not just the eyelid. If you want to see ptosis, get naked in front of your bathroom mirror. You'll see things that are ptosis going south on you. Ptosis means loss of collagen protein, droopy organs and skin caused by hormonal changes, drugs, alcohol, processed foods, white sugar, hydrogenated oils, fluoridated water, dehydration, stress, and trauma. hydrolyzed collagen. What is hydrolyzed collagen? It's a process called enzymatic hydrolysis. It's where the collagen is broken down into the smallest peptide form so it can get absorbed by your cells. That's what my collagen, type 1 collagen protein supplement does. It's lean muscle, muscle tone, skin tone, joint rebuilding, stronger arteries, increased energy, and organ rebuilding. Long-term improvements with hydrolyzed collagen: osteoporosis, high blood pressure, arthritis, weak bladder, obesity, chronic fatigue, and autoimmune diseases. All are helped from hydrolyzed type 1 collagen. Type 1 collagen, hydrolyzed collagen protein 2018. In the Journal of Biological Chemistry from July 10th of 2018, a collagen domain-derived short adiponectin peptide activates signaling pathways and improves glucose and fatty acid metabolism. Adiponectin is a fat tissue-derived adipokine with beneficial effects against diabetes, cardiovascular diseases, and cancer. Accordingly, molecules possess significant pharmacological potential. We identified a highly conserved adiponectin's collagen domain and residues that assist in protein assembly. To our knowledge, this is the first report on identification of a short peptide from adiponectin with positive effects on glucose or fatty acid metabolism. It shows the reason why you want to use hydrolyzed collagen protein to break it down to the peptide versus any other form of collagen protein, including whey protein. In Food Chemistry, March 1st, 2018, there's an article on the sequential extraction of gel-forming proteins, collagen, and collagen hydrolysate from gutted silver carp, a biorefinery approach. In this article, collagen and collagen hydrolysate was recovered from the bone and skin containing sediment residue emerging during pH shift-based protein isolation from silver carp. Hydrolysis resulted in a higher yield compared to collagen isolation by acid or pepsin. Isolated collagens were characterized as type 1 hydrolyzed and maintained their triple helical structure. This form of collagen, but sequential hydrolysis yielded higher degrees of hydrolysis. When collagen hydrolysate was added to silver carp protein isolate prior to gelation, the gel behavior was dependent on molecular weight of the added collagen hydrolysate. More hydrolyzed collagen emerging from sequential hydrolysis improved water holding capacity. Thus, residue from pH shift processing of fish can be used for isolation of high-quality hydrolyzed collagen and provides a promising basis for a multiple product fish biorefinery. July 2nd, 2018, reverse hydroxymate inhibitors of bone morphogenetic protein number 1. Bone morphogenetic protein number 1, or hydrolyzed collagen protein inhibition, is a potential method for treating fibrosis because it's a member of the zinc
metalloprotease family and is required to convert procollagen into usable collagen.
These are the minerals, chelated minerals. Here's my expensive water droplet. Made in the USA, gluten-free, organic, all chelated, all certified by TRAX, which is the chelated source. I'm not just saying it's chelated. It's got the paperwork to prove it. If you want to prevent muscle cramping, how many of you have a muscle cramp in your foot, your ankle, your toes, your fingers, or your calf or leg muscles when you're sleeping? How many have ever experienced that? Any of you? How horrible is that? Not fun when you go into a lockdown cramp. I haven't had a lockdown cramp in 15 years because I've been taking minerals for 15 straight years, never missed a night of taking my minerals, ever. I choose what it goes into my body, and everything goes in for a reason. I don't want to cramp. That's the reason. I don't want to have osteoporosis. Second reason. So we have these. Here's the new, brand new, today, just came out today. Type 1 collagen protein, made in the USA. Gluten-free, non-GMO. It's not vegan. Because this protein comes from bovine, organic, grass-fed hide of a cow. This is my only product that's not vegan. If you are a vegan, take vegan protein. I take only this protein.
What is type 1 collagen?
There's 3 types. Type 1 collagen source is organic grass-fed hide of a cow. Type 2 collagen comes from the hooves of a cow, non-organic, fed with GMO food. Type 3 collagen, which makes up most women's face creams, comes from non-organic, non-GMO non-organic GMO chicken feet. How many of you have ever tasted chicken feet? Raise your hand if you've ever eaten chicken feet. Nobody's gone to a dim sum ever? Really?
No. Chinese.
Chicken feet. When you eat it, it gets real and it dries. What's your finger? Your fingers could stick together. You can't even separate them. Because it dries sticky. Even when you wash your hands after you eat chicken feet, you need like solvents to get that off. When you put chicken feet on your face and it dries, oh, this feels really good. Some good lotion here. You're putting chicken feet on your face. Of course it feels like it's working. It's tightening everything up, feeling good. I don't want it on my face. I want it in my cells. I want it hydrolyzed into the smallest peptide so it can have an effect on my entire body, not just drying on my face cream. Those are the 3 differences of collagen. This is hydrolyzed, type 1 hydrolyzed collagen bovine. 3,000 milligrams in 6 capsules. You have to take 6 capsules to get 3,000. Now a bodybuilder is going to take 10,000 to 12,000. It's in a scoop of powder, and they're trying to get big. So they're taking a lot more than you're taking. If you're a bodybuilder, you can easily double and triple up if you want to take it in a capsule. But if you're a bodybuilder, I suggest taking it in powder. It's easier because you need so much of it. But if you're not a bodybuilder, this is your product. 3,000 milligrams a day of hydrolyzed type 1 collagen protein is fantastic. Now, the reason I put it in a capsule is because I bought really good hydrolyzed collagen protein. Except I wasn't taking the time to mix it up because it clumped up, it tasted crappy, I'd have to mix it in juice, and it would go bad. The can would go bad on my counter because I never ever made it. Once in a while when I made a smoothie, I would add it. So once in a while I was getting it. So what good was it doing me? I want to take it every day. I want to repair my skin, my tissues, my muscles, my tendons, my ligaments every day. What am I waiting to do it once in every 2 weeks when I make a smoothie? I don't want to do that. I don't have time for that. I got to take it every day and go. Same thing with the greens. I don't have time to make a green powdered drink. Maybe you do. Then do it. But I don't. So I take it in a capsule on the go. If you're like me, this is a great product for you. If you're not, do it the other way. I don't tell anybody what to do. Just do it. Do something. Anyway, I'm real happy with this. Another home run. Beta test went great. No chemicals, no soy, no gluten, no milk, no wheat, no peanuts, no GMOs, no shellfish, sweeteners, sugars, artificial ingredients, fillers, chemicals, color additives, binders, or preservatives. All my products. Why would I do that? This is my West Coast diet. I went on a diet 3 years ago in June. Why did I do? No, I'm sorry. 3 years ago in August I went on a diet. So just over 3 years ago. In June 3 years ago, I tore my ankle up. I don't even remember doing it. It was the most puzzling thing. I know I played hockey. I know I was running a lot. One morning I woke up. I could not step on my right ankle. Could not. Tried to. Worst pain I ever felt. Got on my all fours, crawled to the bathroom. Went to the bathroom. Got out of the bathroom, crawled down the stairs, crawled. Couldn't put any weight on my foot. Got an ice pack and laid on the floor with my ice, elevated my foot up. This is at 7:30 in the morning on a Saturday. Yelled up to my wife after I was done icing. It's about 8 o'clock now. She comes down like, "What are you doing up?" I go, "It's a long story. I don't know what I did, but I need crutches. Can you drive and pick up crutches at the local drugstore?" She goes, "Okay." She went and got crutches, brought the crutches back to me. I said, "Okay, let's go in the car and let's go. I need to get an MRI of my foot." So she drove me to the MRI. I did an MRI. The worst pain I ever had was putting my foot in an MRI because it had to be straight, in a boot, laying down. I can't describe that pain. I told the MRI guy, I go, "I can't do this." He goes, "You got to sit quietly and do it." I go, "I cannot do it." I did it, but it was painful. Then it came back, the report, I had a couple torn ligaments, and it was crazy. I didn't even have nothing on my mind specific, but I did play hockey the night before. I must have torn it in the game. And with the adrenaline and coming home, I didn't realize it. I don't know. Swelled up overnight, in a lot of pain. So I called surgeons. The surgeon said, I said, "Do I have to have the surgery?" I called 2 different surgeons. Both surgeons said, "You don't have to have any surgery. It will heal on its own." You just have to take it easy. Stay off, use the crutches, stay off of it, let it heal up. I go, how long? 5 to 6 weeks, minimum. Maybe longer. I go, okay. So for the next 6 weeks, it was longer than that. It was probably 8 or 9 weeks. I tried staying off of it as much as I could. I did not exercise. I did not run. I did not work out. And I ate. Same as I always have been eating. I was on the seafood diet back then. And I just ate barbecue every night, beer, whatever. I was just eating, having a good old summer vacation, not working out. So I gained 20 pounds. Now, when my ankle started feeling good, I wanted to start running again. However, whenever you tear ligaments or in a joint like that, and you want to start exercising and you know you're 20 pounds heavier than you used to be, you psychologically get scared to run on it with the increased weight on your body. Even though 20 pounds is not tremendous, when you're coming off of an injury, psychologically that was a lot to put on weight. I did not want to re-tear the ankle. So I said to myself, I've got to lose the 20 pounds before I start running because I'm too scared to run. So I called up a buddy of mine, he's a San Diego Chargers chiropractor, and I said, hey, what diet do you put the athletes on when they come back from summer vacation and they're overweight? He goes, oh, I got a really good diet. So he showed it to me, and I didn't really love everything on it. And then I came up with my own, and then I blended the two diets together to come up with this one. Now, this isn't a rocket science diet of any, it's just mine and my friend's diet together. And it's more of a paleo type of a diet, but let me go over it and show you what's in it. It's designed for you to lose 15 pounds in 3 weeks. And all you have to do, no exercise, just eat correctly for 3 weeks straight, and you will lose 15 pounds. I ended up losing 15 pounds in 3 weeks. And then I started running and staying on a similar, not strict, but similar type of eating, and I lost another 8 pounds. So I lost a total of 23 pounds. And I've gained a couple of those pounds back in the last 3 years, but not much. I've maintained my weight. Okay? Here's the diet. No carbs, no dairy, no sugars, no sweetened teas or candy or chocolate, no bananas or strawberries. Those are really high in sugar. No carrots, high in sugar. No nuts. Those are high in oils. No oils. You can't cook with oils. No butters. No salmon for those 3 weeks because it's high in oil. No ground beef. No whey protein. Whey is dairy. Only collagen protein. No vitamins A or D. No breaded or fried foods. So I know what you're thinking. What can I eat on the West Coast diet? Clean, organic, non-GMO protein. Fruit and vegetables only. All that you can have. That's it. Example, organic kosher chicken from Trader Joe's and ground turkey, wild light fish from Costco, like cod, comes in individual fish fillets that are 7 ounces, frozen. You put it in a frying pan with a little bit of water. Add any seasonings you want. Cook it for 5 minutes and you got a delicious piece of fish that's healthy and light. Examples of breakfast. Today, This was my breakfast here at the hotel and has been my breakfast for the last 3 years. Hard-boiled eggs, and you may snack on those throughout the day if you're hungry on the diet, and a green apple. That was my breakfast today. I had 2, they're really small, the little hard-boiled eggs here. I had 2 small hard-boiled eggs and a green apple. I added a little coffee today. That was my breakfast. It's been my breakfast for 3 years. Very low calories, but it's got protein, keeps me completely full all the way to lunch. No problem. Lunch, my favorite restaurant is Whole Foods. It's my new favorite restaurant. Mondays, Wednesdays, and Fridays when I'm working, I go to Whole Foods at lunch. What do I get? I order an organic salad of spinach, kale, lettuce, broccoli, peas, asparagus. No oil or vinegar dressings at all. If you're going to put anything on the salad, you could put a little piece of squeezed lemon. That's it. Organic fruit you could put on the salad, like apples, a couple berries if you want. And then for protein, you could put one piece of baked chicken or turkey breast. There's your lunch. Dinner, raw or steamed mixed vegetables. If you steam your vegetables, only steam them for 30 seconds to a minute, just to get the color green back. That's it. They're still going to be crunchy. Don't overcook your stuff. You can eat an organic salad if you want, but then I put a piece of chicken or fish, the way I described it, baked, no butter, no oil, and you can use any seasonings you want. Now the first 4 days you will hate me. After that you'll love me and you won't look back ever. You'll get used to this. You'll crave fruits and vegetables. You won't crave junk anymore. First 4 days you'll be grumpy. After that, smooth sailing. Late evening snack, you could have a piece of fruit, you could have raw vegetable sticks with or without salsa, or a hard-boiled egg. And in 3 weeks on this diet, you will lose 15 pounds. If you stick to part of this diet afterward, you should maintain. If you throw in exercise into the mix, you'll be fine. You'll be burning a little more calories. Diets are doable, but you have to flip the switch first. I had a patient come in, he was at least 500 pounds. He's a good friend of mine. He runs the hockey league. And he came in and tried to be on diets. All these years I've known him, I've given him products. Nothing's ever worked for him. So he came in, he told me that he thinks he's going to die and he has to do this. And I told him, I'm not going to help you unless you flip the switch. When you flip the switch, you come back and talk to me. What I mean by flipping the switch, I told him, is that you're going to control everything that goes into your mouth. You're going to be on the diet. You only put this stuff in your body. You only do it. And you're accountable to only you. You're not doing this diet for anybody but you. But you have to do it by flipping the switch first. Once you flip the switch that you're going to do this, you will be successful. Until then, you're wasting my time. So he said, all right. He came back a week later. He said, Doc, I flipped the switch. I said, for real? He goes, yeah. Okay, let's do this. You have to flip that switch first. I know it sounds weird. I'll tell you, the diet for me was harder than someone who's been dieting their whole life. I know this sounds even more weird. However, when you're used to eating anything you want, whenever you want, as much of it as you want, and all of a sudden you hit the wall where you cannot do that anymore, and you have to go on a diet, it is extremely hard. Those 4 days, I wanted to kill people. I was not happy, I was grumpy, but I had flipped the switch that I wanted to do this. So I knew I was going to succeed at it, but it was really hard. It was super hard. I could not, I had withdrawals, sugar withdrawals. I was like a heroin addict on sugar or something. It was terrible. I remember driving my daughter up to college for the first time. And I was up there. We moved her in. I'm moving her. I'm hungry. I'm grumpy. And so we all go out to dinner. Me, my daughter, my wife, my other daughter, and then my wife's sister and her daughter. We all go out to dinner in Sonoma. And we're on the square in Sonoma. And my sister-in-law likes to eat anything she wants. She didn't really care. And she was like, takes us to this restaurant. And I said to them, I'm on a special diet. I have to have fish and a vegetable. That's all I want. So my sister-in-law goes, oh yeah, they got it. We're going to this place. So we get to the place. We wait in an hour-long line. They finally seat us. And we're ordering. And nothing on the menu was good except they had one item of fish. And they got to me. I said, okay, I will have this fish. I need it cooked with no butter. No. She goes, wait, we're out of fish. I almost wanted to kill her and my sister-in-law at that point, because now they're asking me to break my diet. And there was no way I was breaking my diet. So I said, we can't eat here. My sister-in-law goes, no, we're eating here. We waited, we're eating here. If you don't like it, you can leave. So I said, bye. I left. I was so mad. And I'm walking around Sonoma, and it's like 9:45 at night. So nothing's open. Everything closed at 9, except for this one bar. I walked in this bar, and I walked up to the bar, and it was like a bar restaurant. But I went up to the bar, I said, are you still open? Please tell me you're open. Because nothing else was open. He goes, yeah, we're open for another 10 minutes. We're open till 10. I said, oh, thank God. Can I order? He goes, sure, what do you want? I go, he gives me the menu. I go, I don't want the menu. Is your chef here? He goes, yeah, he's in the back. I go, can you go get him? The guy saw I was like distraught. I was hungry and I was irritable. I was on the start of this diet. I was like not doing good. The chef comes out. I said, hey, I'm on a special restricted diet. I said, I want a piece of white, light fish. Do you have anything like that? He goes, yes. I go, great. You need to cook it without butter, without oil. Preferably, if you can steam it, would be even better. You could put any spices you want on it. And I need a green vegetable with no flash steamed, with no butter and no oil. Can you do that for me? He goes, yeah, I can do it. He goes, I'll have to charge you to do this special order. I go, I don't care what you charge me. Money's not the problem. I need you to do what I need you to do. He goes, I'll do it. So he goes, I said, and put it in to go. He goes, okay. So he gets it, brings it out, $45. He charged me a lot of money. Because I think they only had one item on their menu, and it was Chilean sea, or a couple items, but he charged me for more than the most expensive item. And I didn't care, because now I had this one piece of fish and green beans or something. I was so happy. And I took it back to the other restaurant, and they were already like done. They were on their dessert. And I just came in with my little box dinner, $45 box dinner. And I ate it. I was so happy. But I couldn't fathom getting off this diet. I was strict for 3 weeks. That's why it worked. And because it worked, and because I got used to it, it became a lifestyle. Now I eat anything I want, but breakfast and lunch, you're looking at what I still do. The only difference now is at dinner, I have desserts now, I eat dinner, anything I want at dinner, and I still maintain. Thursdays are my worst. I have a couple pieces of pizza and a salad. Thursdays are horrible for me. I dread it, because lunch I screw up the whole week. But I can do that now. Doesn't matter.
Part 1 of nutrition is completed. Please proceed to part 2. Again, if you have finished watching the video, please make sure you go back and you do your own reading on all the abstracts and the articles. Like I said, that is included in your hours for the continuing education. Please proceed to part 2 of the nutrition series. And if you have any questions, you can always call us at 949-707-5785 or email at triadseminars@gmail.com. Thanks again for choosing Triad Seminars, and we hope you enjoyed this portion of the seminar.